My name is Michael Benefield. I'm with Albany State University. This is my assessment of the mouth, nose, and throat for the BSN program. So the first thing I'm going to do with my patient is I want to examine the external nose, the nares in particular, and I'm looking for symmetry in the nares. I'm also looking for any lesion, any swelling, any drainage, anything like that. So I'll start by assessing that externally, and looks like everything is symmetrical. The next thing I want to do is I want to look inside the nose, okay? And when I'm looking inside the nose, I'm looking in the nares specifically for the nasal mucosa, the septum to make sure that it's intact, any swelling and drainage that I note, and I'm also looking at the turbinates when I'm inside, all right? Alright, and everything seems to be intact. I don't note any redness, any swelling of the nasal passageways. The mucosa looks nice and moist, and so we're going to move to the other side. And as with the other side, the septum is intact also. I don't notice any drainage, any swelling, and the nasal mucosa still seems moist. So the next thing we're going to do is I'm going to move on to the mouth, and we're going to check her mouth, throat, and when I look inside the mouth itself with my tongue blade, what I want to do is I want to look at her teeth, her gums, her tongue, and we're going to go side to side, okay? So I'm going to get you to open up, right? Inside. Okay, looking at her teeth and her gums. Everything looks good. All right, and so now I'm going to look at the buccal area in the floor of her mouth. And so what I'm going to do is I'm going to ask her to lift her tongue up. Okay. All right, I don't notice any lesion or any swelling there. Okay, so the next thing we're going to do is we're going to move on to a palate. So open up real wide to me. I'm going to examine her palate. At the same time, I'm also going to examine her uvula and her tonsil area, and I would give her tonsils probably a 2+. They look like they might have some swelling. Okay, so go ahead and close your mouth. The next thing that we want to do is we want to look at cranial nerves 9 and 10 when we're doing that, and we're also going to check the gag reflex. So I'll have you open your mouth again. I'm going to stick the tongue blade in my mouth until you feel it gag you. Okay. Alright, here we go. Alright, so the gag reflex is intact. The last thing that we're going to do is we're going to check cranial nerve number 12, and we're going to do that by having her stick out her tongue, and she's going to say ah. So stick it all the way out. Ah. Okay, and that seems intact also. Alright.